Hello everyone, my name is Dr. Sri PRATHAP MOHANA. I am the organizer for the SPMM courses. In this video, I am going to talk about the recent changes made in the CASC exams. I am also going to explain the structure of the new CASC exams and what you need to know in order to pass the exams. I'll also discuss the key competencies which you'll have to demonstrate in terms of your stations related to communication skills and stations related to management plan. The CASC exam comprises of 2 circuits with 16 stations for each candidate to perform. In the first circuit, you will have 8 stations to perform. In the second circuit, you will have another 8 stations to perform. In the first circuit, you will have 4 minutes reading time, followed by 7 minutes performance time with a warning at the end of 6 minutes. Majority of these stations are management stations. In the first circuit, among the 8 stations, you will have 6 stations focusing on management, 1 station on history taking, and 1 station on examination. In the second circuit, you will have 90 seconds reading time with 7 minutes performance time with a warning at the end of 6 minutes. Among these 8 stations, 4 stations are related to history taking and 4 stations are related to examination. So in total, you will have 16 stations to perform. 5 stations are focused on testing your history taking skills, 5 stations on examination, 6 stations on management. In all the 16 stations, you have to demonstrate excellence in terms of your communication skills. And that is the key factor and has got equal weightage in terms of passing all the 16 stations. In terms of history taking, you may be tested on a number of different areas, especially presenting complaints and past psychiatric history, physical health history, developmental history, personal and social history, and getting collateral information from carers or family members or friends. In terms of examination, you may be asked to do a mental state examination on psychotic and or non-psychotic patients, cognitive examination, capacity assessment, risk assessments, and physical examination. In terms of patient management, you'll be asked to give a clear formulation and case discussion. You'll have to discuss the management options using the biopsychosocial approach, incorporating the medical treatments, psychological treatments, and psychosocial interventions which can be offered. You're expected to provide a holistic management plan, which is also realistic. You're expected to provide safety planning. Safety planning are also considered as part of patient management stations because you're also managing the risks. You're also expected to know the legal and ethical aspects. However, specifics of mental health legislation will not be tested in management stations. The candidates may come from different countries with different legislation. Therefore, he or she can refer to the mental health legislation and you don't have to go into the details of the legislation. The college do not want to explore this issue. In the examination, in terms of running order, you are more likely to get at least 1 station on risk assessment or safety planning and 1 station on risk management. You're also expected to get one station on cognitive assessment or capacity assessment. You are expected to get one station in terms of eliciting physical health history, or you may be asked to do a physical examination. There is a 50% chance of either taking a physical health history or doing an examination. I have listed down the specialty area and the minimum number of stations expected under each specialty. General adult, 2 stations. Old age, 1 station. Child and adolescent, 1 station. Intellectual disability, 1 station. Forensic psychiatry, 1 station. Substance use, 1 station. Psychotherapy, 1 station. And any specialty area, 8 stations. In total, there are 16 stations, and they are broken down as I have described. In terms of range of stations, you may get patients from any setting. It could be outpatients, inpatients, or community settings. You may get patients from any age, starting from childhood to old age, and any developmental ability. And also, the college may test any psychiatric disorder which is listed in ICD. In terms of new stations for the future exams, there are 2 possibilities. One is incorporating element of video consultation. Number 2, an active examiner asking questions at the end of stations. These are 2 possibilities for the future exams, and please watch out for it. In terms of feedback forms, you'll get more detailed and better structured feedback forms. They have free text back with computer-based markings. The narratives will be included, and the actual station scores will be revealed to the candidates. Like I have mentioned before, communication is key in all 16 stations. The important competency domains you are expected to demonstrate include personalization and respect, recognizing and responding effectively to cues, demonstrate empathy, providing clear and accurate information, demonstrate an inclusive approach, bearing in mind gender, ethnic, social and cultural context of a patient as they come from diverse backgrounds. In terms of interview and communication skills, I'm going to list down the important areas in which you have to excel. Number 1, the candidates are expected to demonstrate advanced listening skills. Active listening includes asking questions at the appropriate time in a logical sequence to the person's last contribution. Good active listening includes allowing the person to say what they want to tell you, and sometimes helping them by clarifying and also summarizing what they've already said. So by doing this, you demonstrate to the examiner that you are listening and have understood them. Point number 2, pick up verbal and non-verbal cues. It's important to stay alert to verbal and non-verbal cues. Such cues should be used to increase your understanding of the person's situation. The cues can include gestures, pauses in speech, facial expressions, etc. Point number 3, demonstrate empathy and make sure you use empathic statements appropriately. Point number 4, avoid use of jargons and overly technical language. Point number 5, give information in a structured, focused and fluent manner. The consultation should follow a logical structure and organized without some elements thrown in apparently at random. Point number 6, appropriate questioning. You should be able to demonstrate the appropriate and fluent use of appropriate questions and techniques in a way that does not make the patient uncomfortable. Point number 7, you should be able to give balanced and factual information. Point number 8, you check on recipients' understanding and elicit concerns generated by questioning and make sure that the recipient has understood the information given. In terms of management stations, you should develop an adequate management plan reflecting knowledge of the current best practice. Your management plan for the case should be adequate. You have to develop an obvious management plan, complete enough to satisfy the examiner that you are a safe practitioner. You would be expected to show that your clinical management skills are in line with the current UK best practice. You should be aware of up-to-date national guidelines such as those published by the NICE and demonstrate you have an evidence-based approach. The possible risks and benefits of different approaches, including prescribing and psychological approaches, should be clearly identified and discussed. Your knowledge base is also important in this area. And lastly, the management plan should be coherent and feasible. I wish that all this information proved to be useful, and I sincerely wish you all the best for your exams. Thank you for listening.